Hello, welcome. My name is Stephen Smith. I'm the founder and CEO of NOCD, and really excited to be here today to talk about why accessing ERP treatment is difficult for OCD. And so last week I was on with Dr. Patrick McGrath, and also, we were talking about concepts related to doing OCD treatment. So OCD treatment is oftentimes somewhat counterintuitive, where people are asked to purposely trigger their obsessive fears, which are often different thoughts, images, and urges. And instead of trying to push those thoughts, images, and urges out of your head, people with OCD are asked to do different they're asked to accept uncertainty behind those thoughts, images, and urges, and that's leads people to getting better over time. And so today I want to talk about why people with OCD oftentimes can't access that treatment. So treatment's very effective, but it's challenging to just get it, considering a variety of factors. And so really excited to be here again, and thankful for Made of Millions for having me. Again, my name's Stephen Smith. I'm the founder and CEO of NOCD. And what we do is we provide online therapy for obsessive compulsive disorder. So we specialize in really providing access to evidence-based treatment for the OCD population. And through that process, and over time, we've learned really why this treatment isn't accessible. So I'm going to share with you my learnings today. Also going to go and talk about the details as to what's happening in the healthcare industry and what we can do to augment things. So first and foremost, I think people with OCD often know that there's a problem with the condition, right? If you talk to someone, it feels like they'll tell you it feels like being imprisoned in your own brain, right? You're just kind of walking around every day in silence, but you have this thought that sticks, right, that you just can't get rid of. And no matter how hard you try to make it go away or try to find the solution or reason behind yourself having it, it stays there and it creates extreme distress. And it oftentimes challenges really personal attributes of yourself, right? So OCD attacks your core values, it attacks your character. And as a result, people suffer, right? So before people get diagnosed, though, people will sometimes suffer for years on end. I mean, it can be up to 10 years until somebody accesses evidence-based treatment. And that's often the case. When they do get treatment, right, ERP treatment, it's oftentimes extremely expensive. You'll go and you'll have treatment that ranges from $200 a session all the way up to $400 a session. And it's all out of pocket, meaning insurance companies don't sponsor it, right? And that you're just like, how can that be? How can you have a problem that's so crippling that insurance doesn't, and how can you have a problem that's so crippling that doesn't have treatment sponsored by insurance, right? It doesn't make sense. And then the third is like, you'll go and you will try to find a therapist that specializes in OCD, and you won't find one in your area. And again, it just doesn't make sense. And so I think that is the conundrum here. It's like you as a person with the condition, you're not alone. There's 1 in 40 people with it, but treatment is just so challenging to access. And when you finally find that therapist that's in your area and you can afford them, they often will have a wait list, right? They can have a wait list up to 7 months. So even if you're feeling terrible right now, you're still going to have to wait. And that's the problem that I personally faced. I have OCD. I told my story last series, but just to kind of recap, I have OCD, was misdiagnosed 5 times, went to rock bottom, developed severe depression, ended up trying to find a therapist, and there was not really one in my area that was in network. So I had to find someone who was out of network, meaning they didn't take my insurance. They charged $300 out of pocket per session. They had a 7-month wait list, and that was my only option towards getting better. But thankfully, I was able to access that therapist. I was able to get better, and I kind of got back on my feet and regained my life. And so it's really great, because when you do go through treatment, you get better, especially because OCD is really treatable, but it's just so difficult to get there. So we started NOCD kind of based off that problem. Many people in the company also have that same experience. And, as we've tried to grow the company, what we've learned is that, the healthcare industry doesn't really know much about OCD, and they weren't really willing to help scale treatment for this condition, right? And it just doesn't make sense. And so what we had to do is, by just trial and error, learn why the healthcare industry today doesn't see the OCD problem. Why don't they treat the OCD problem? We had to learn all of that, and I'm going to walk you through why here. And so, this is a graph that I often use when presenting, because I think it does a good job at showing, the cycle that occurs with OCD. And it can, by showing the cycle, you can show where you to interject to break the negative cycle. And this isn't the OCD thought cycle. This is the OCD problem cycle from a macro industry level. And if you can interject in the broken part of the cycle, you could fix the cycle and you could improve the overall system. And so kind of when we were growing in OCD, we realized that at the end of the day, you know, different therapists, different medications, different technology services, they're all sponsored by one group, and that's the payers. Those are different health plans, health insurance companies, different managed behavioral health organizations that essentially manage people with mental health issues within a health plan population. So those are the people, those are the entities that basically fund the treatment services for people with OCD. Whether they know they have OCD or not, they fund those services. And so when analyzing, the problem, we say, okay, well, it makes sense to go right to the payers and to get them to sponsor this treatment. Well, if payers don't see OCD in their data, how are they going to know the implications of sponsoring it? They don't know that if you sponsor treatment for it, people actually get better. And so what we did is we, went into the problem, we saw the problem, we faced it, and took a step back and said, okay, well, how can we fix it? And that's where this kind of chart originated from. So with OCD, right, because it's so misunderstood, different providers within these different health plan networks, they often misdiagnose it. Meaning, if you have OCD, you'll oftentimes walk right into a therapist's office that takes your insurance. They'll talk to you. They'll say, oh, you must have just generalized anxiety, or you have some type of anxiety, but I don't really know what it is. And they'll give you that feedback. And then they'll say, okay, for every time you have a thought, let's practice on trying to stop it, right? Let's practice on challenging it. Let's do all these different exercises. And those exercises actually make you worse because they're giving into your compulsions. So the point is here, by not diagnosing OCD correctly, people don't get the right treatment. But what also happens is, in addition to that, when that therapist goes and does their documentation after the visit, they will send what they call claims back to the health insurance company that sponsors you, because those health insurance is paying for your visit, and they'll say, this person has general anxiety, and we did a 60-minute psychotherapy session for them to make them better. And so they're basically doing something that's actually really profound. They're misdiagnosing and miscoding you. So when the health plan basically goes and they look into their data, and now we're in step 3 here. So step 1, they misdiagnose you. Step 2, they provide you with ineffective treatment. They miscode you. Step 3, they look into your data. When the health plan looks into the data, what happens is they see a bunch of people with OCD who are misdiagnosed and miscoded as having undefined anxiety, as general anxiety, as maybe depression, and these other conditions. And they say, oh, I must have an issue in my population with generalized anxiety disorder, or with undefined or panic disorder, right? And so they then associate the wrong condition to that population. And and then what happens with the misunderstanding is, basically, when they develop specialty programs to solve problems, they're developing programs not for OCD, but they're developing programs for generalized anxiety disorder, for depression, for panic disorder. And those are important populations to treat, but they're missing the OCD part in that. And so what's happened is, then by developing the specialty programs, they're going back to those same network providers saying, hey, we need to further identify patients with generalized anxiety, patients with depression, because when those patients don't get better, they end up going to the emergency room. They end up going to residential treatment. They end up going to all these other places in the healthcare system because they're not healthy. And the problem is that unhealthiness is associated with the wrong condition, the wrong root cause. And it stems from this cycle of misidentifying, stems from mismanagement, miscoding, and then basically misunderstanding. And if you can break that cycle, what happens is then from a macro level, you can get these payers to see the size and the cost of the OCD problem today that everyone is facing. And it's a matter of doing that. And then if you can do that, then what happens? You could fix this problem because these payers that are sponsoring care, they will then go and they will do what? They'll develop the specialty programs for identifying and managing OCD, knowing what it does to their overall healthiness of their population, of their members, and the overall cost of care for each member. It basically keeps people healthy and drives down their overall costs. And so at NOCD, that's what we had to figure out. So what we've done is we've identified people with OCD. We've then gone and we've partnered with different health plans to serve members, knowing that by keeping them healthier and preventing them from becoming severe, we can basically help that health insurance company, see the impact of managing OCD, both on their population clinically, but also on their costs. And that's what you have to do from a macro level to spread awareness, because when people know that if you treat OCD, you basically, not only keep people really healthy, but you also save them a lot of money. You then go and you encourage people to spread awareness that can actually afford to do it at the mass level that we need. And, that's kind of what we've been doing here at NOCD is we're changing the back end infrastructure of the OCD treatment system to help people more easily access care in network. So when you go in network, you see therapists that are effective at treating OCD, that can diagnose you and manage you, and also are affordable. And at the same time, we're helping payers see the size and the problems of OCD in the market, while also knowing that it's extremely treatable. And if you treat it, you're going to see an associated cost savings. And that's important because if they can associate the right cost savings to OCD, what will they do? They will also reimburse the therapists that are working so hard at treating OCD much more, knowing that they're making instrumental changes to people's lives and to the healthcare system's overall costs. And so that's kind of our goal, is we want to realign the system in such a way where we can transform people's lives, we can transform the way payers see this issue, and we can transform the way providers get reimbursed. And so, I think that's the problem, that's the solution. There's a variety of folks out there who are probably having some questions. If you'd like, I'd be happy to answer them here or keep going. But there's a lot that we can do, and it's just a matter of understanding where the issues occur. It's a matter of understanding how to solve those issues. So I'll keep going here. In terms of helpful resources, right? There's a lot of companies today that are focused in identifying people with OCD. Imagine there's a lot of nonprofits doing the same thing. I wanted to just list some resources here that could be helpful for folks, because I think not only are they helpful for folks in terms of they offer great suggestions, they offer treatment guidance, but also they're helpful in kind of how they're impacting the system, right? So we have here a problem cycle. We know that the problems with misidentification, with mismanagement, I'm not sure if even the system is knowing that these companies are making and these nonprofits are making changes, but they are. So if you think about it, the OCD Stories is a podcast. Stuart Ralph does a tremendous job at delivering content each week to the OCD community, delivering hope, spreading information, awareness. And by doing that, he helps people identify their own symptoms, right? People know that if they can listen to a podcast and hear someone's story, they may know they're not alone. They may know that that person's going through exactly what they are in the moment, right? And they may know that there's a name to what's they're suffering with. And that's a pretty profound moment, because that's when someone self-identifies with their OCD, and they also self-identify that there's an opportunity to maybe get further help, right? And so Stuart, in his podcast, The OCD Stories, helps kind of facilitate that. The next step then is, where do you go for treatment? Well, you go for treatment to places like the CBT school, places like NOCD, therapists in person that you can see, like Dr. Phillipson in New York. There's a variety of places that you can go for treatment to manage your OCD. So there's several groups today that are out there improving the way we identify OCD using content, right? So Made of Millions, perfect example. The work that you did with intrusive thoughts, the work that you're doing with your overall Made of Millions site, just being able to spread content and identify people who are suffering because they're Google searching and they're making that epiphany on their own that, yes, this is what I'm going through, OCD, anxiety, etc. That's crucial, because then the next step and then is they're empowered to say, okay, well, now that I know kind of what I'm going through, where do I go to get treatment? And that's where treatment resources come in. OCD Game Changers, same thing, with different events in different cities, different online webinars. There's so many different groups that are further augmenting the way we identify and manage to fix this broken problem cycle. NOCD is just one example, and that's why that we're here in the middle in this graph. But there's a variety of different groups out there to fix the system. And you know, the problem again is if you break it down, is somewhat simple. Just there's no real effort to identify OCD, even though it affects 1 of 40, even though it causes people to be 10 times more likely to die by suicide when left untreated, even though 25 to 40% of people with OCD suffer with a substance use disorder. There's so many issues with OCD, but it's been misidentified, and so it doesn't show up in data. Then again, because it's misidentified, providers and network don't prioritize diagnosing and coding it. Data gets disconnected, people get ineffective care, payers don't see then the size and the prevalence of the issue, and the cycle continues. So we have groups today that are fixing that broken system, and by doing that, what we're going to see in the future is a much more awareness being spread, not just by incredible community organizations like the ones listed on the screen, but also by big time health insurers, by in the UK, the NHS. There's so many different groups that will start to see this as time progresses. And as a person with this condition, what do you think? You think, okay, well, that's going to be hopeful, right? Because when you have the whole industry behind you getting treatment, that's really special. And the benefit is there are few conditions in mental health as treatable as OCD, given, behavioral therapy is so effective, exposure response prevention, acceptance commitment therapy, mindfully learning how to resist compulsions. That is the goal. And yeah, so that's high level. Today's been pretty short. Just wanted to address the reasons for why ERP treatment is so inaccessible today, because we were talking a lot about ERP treatment last week. But would be happy to answer any questions related to the access issue, related to what we can do to further augment the way we, identify and manage OCD. Just would be happy to open up the floor for some questions. And I'll tell you this too, is if you have questions that you'd like to write directly to me, please feel free to send me an email at info@nocdhelp.com. We'd be happy to answer questions there. But again, I think there's a lot of interesting changes happening today, and it's to help improve access to treatment and to help improve the way we identify people needing treatment. And that's the really promising. That's really promising, because 5 years ago we didn't have anything like this, right? But so much is happening today. All right. Well, thank you all very much. I hope you enjoyed the presentation. And again, if you have any questions, please feel free to email me at any time. Take care.